Hello everyone. Today we will discuss the topic peer-to-peer teleconsultation as a part of the Ocular Telehealth curriculum. In the present talk, we will discuss the definition and types of peer-to-peer teleconsults in terms of process, referral indications, and case examples at the primary, secondary, and tertiary levels of eye care. To introduce the concept of different levels of eye care, we will use the LVPEI model of eye care and learn how to apply peer-to-peer teleconsultation at each level. At the primary level, a vision center provides eye care for a population of nearly 50,000. 10 such vision centers are linked to one secondary center, together called a village vision complex. Community eye care services facilitate the effective screening of the local population and their referral as patients from the remote villages to the vision centers. A trained vision technician manages the vision center, screening individuals with eye ailments, providing services such as corrective eyeglasses, and referring persons with complicated conditions to the ophthalmologist in the nearest secondary center, where comprehensive ophthalmic care is provided. Patients needing specialty eye care are further referred to a tertiary care center, and complex eye conditions are then sent to the Center of Excellence if required. Peer-to-peer teleconsultation can be defined as an interaction between specialists and non-specialists, or between two specialists, providing eye care and expert advice to patients in remote communities through audio-video technology. These peer-to-peer teleconsultations can effectively eliminate a variety of barriers such as distance, saving time and money for patients, and diminishing the burden on the healthcare system by allowing for distributed care. Let us look at the process of peer-to-peer teleconsultation happening at the primary level in our network. The steps include an initial patient visit to a primary care vision center in a rural area. Consent for teleconsult, history, slit lamp eye examination, intraocular pressure details, and the anterior and posterior segment photographs are captured by the vision technician on the electronic medical record on a tablet and sent through the cloud network to an ophthalmologist at the tertiary eye care center. Vision technicians are primary eye care providers with a high school diploma who have been trained for 2 years to provide primary eye care. They fulfill the 3 R's of eye care: refraction and prescribe corrective lenses, recognize vision-threatening eye problems, and refer them to the next level of eye care as required. The ophthalmologist located at the command center in the tertiary center reviews the case details, pictures, and then communicates the plan of management with the vision technician and the patient via a video call on Skype Lite. The ophthalmologist's advice and e-prescriptions are captured online at the vision center location and provided to the patients. We have formulated specific referral guidelines for teleconsultation at the primary level with an objective of improving the efficiency and avoiding unnecessary referrals. Referral indications include chalazion, stye, blepharitis, pterygium involving visual axis, entropion, ectropion, conjunctivitis, ocular surface squamous neoplasia, meibomitis, viral conjunctivitis, corneal foreign bodies, spheroidal degeneration, etc. These referral guidelines were reinforced through periodic workshops for vision technicians. Various forms of keratitis and the neovascularization of the iris are also part of these referral indications. The referral guidelines are also available on the tablets of vision technicians. Both anterior and posterior segment indications are shared through pictures. Another important measure for efficient referrals is a triaging system, classified by the referral color coding. Red indicates an urgent referral, yellow is semi-urgent, and green denotes conditions that can be managed and are to be managed by teleconsultation alone. Additional tools to capture a usable and quality anterior segment photograph help supplement the information gathered from such an interaction. One such device that we have built is a smartphone anterior segment image capture attachment called Grabby that can be easily used by a patient, caregiver, or eye care practitioner on any smartphone. This device has the capability to capture clinical quality details, facilitating effective teleconsultation. During peer-to-peer teleconsults at the primary level, our fellows and residents are able to detect and manage simple to complex eye conditions, conjunctivitis to eye cancers. In the past year, we had 46,532 teleconsults at the primary level, out of which 84% were managed by TC alone at our primary care centers, and only 16% of patients required referral to the next level of eye care. These are some examples of various conditions managed and diagnosed using peer-to-peer teleconsults at our primary care level: trauma, conjunctivitis, keratitis, ocular cancers, etc., in pediatric to geriatric populations. Another example of peer-to-peer teleconsults is our Silver Sight initiative, a home care service using teleophthalmology to reach elderly and disabled patients in both urban and rural areas. At the secondary level, peer-to-peer teleconsultations take place between fellows and residents with experts at the tertiary level. This communication is captured in an electronic medical record that can be accessed at both ends. The necessary investigative reports are sent by free using social media applications such as WhatsApp. Our next goal would be to embed these referrals through a referring physician portal in a central teleconsult portal to allow for seamless data collection. The case examples of diseases consulted for at this level include a range of eye conditions with a higher level of diagnostic infrastructure. Examples include solving dilemmas related to inflammation versus infection, or a case of hypotonic maculopathy following cataract surgery, CSCR or CNVM. These diagnoses are made using the clinical examination details from the electronic medical record and supporting investigations, such as fundus photographs or OCT. Recognizing the importance of teleophthalmology during the COVID-19 pandemic, we developed and launched a mobile app-based telemedicine portal called Connect Care. With this app, our doctors can now connect with patients through a simple process on their mobile phones, with appointments scheduled just like a virtual outpatient clinic. Our primary purpose using these teleconsult portals post-lockdown was to reduce follow-up visits. This, in turn, reduces congestion in our waiting rooms, allows for remote review of reports, and to provide second opinions to new patients. Important prerequisites for a remote eye exam include obtaining detailed patient history, including the patient's self-assessment, vision assessment, and asking the patient or care provider to assist in the visualization and imaging. It is important to note in the history if it is a new patient or a follow-up patient, also to note the details concerning the affected eye, vision, and the detailed note of all the symptoms. Self-assessment by patients before seeking remote eye exams are important. They should note down symptoms, check the quality of vision by comparing the eyes, or looking at oneself in the mirror and phone, or seeking the help of a relative or caregiver. A variety of useful screening applications, based on the desktop or smartphone, are available for estimating distance or near vision that may be used by a patient or caregiver. An example of this is the Peak Acuity application. These are examples of peer-to-peer teleconsults at the tertiary level through the Connect Care app, where non-ophthalmologists and ophthalmologists assisted in the process. This is a story of mucormycosis, where primary retina consultant was able to provide necessary advice to a patient admitted in the hospital and could provide cross-consultation with the oculoplasty consultant as well. This is a story of a limbal dermoid in a neonate, which was managed with cross-teleconsultation between the pediatric retina specialists and pediatric cornea specialists. A specific portal for referral doctors for an effective peer-to-peer teleconsultation is in the implementation phase. This portal allows an eye care professional or an ophthalmologist to book an appointment to discuss a specific patient. A 15-minute time slot is provided to the referral doctor to discuss the patient's details. This service is provided free of charge. The referral doctor can view the patient information following a visit to the tertiary center, and this has the potential to reduce the need for follow-up visits and the need for referral letters. To summarize, peer-to-peer teleconsultations occur at all levels of eye care. We need to identify conditions that can be managed at each level. It facilitates appropriate referral across levels of eye care, especially by using tele-triage for appropriate urgencies. Add-ons such as smartphone adapters help in effective sharing of patient details. Referral portals help direct peer-to-peer interactions in a defined time. And the journey continues to build people-centered eye care solutions so that all may see with excellence, equity, and efficiency. Thank you.